Welcome everyone to Click Moment, where the right information at the right time is a portal from where you are to where you want to be. And today we have the pleasure of having a conversation with Dr. Raymond Turpin, who is the executive director and board member at Pearl Psychedelic Institute in Waynesville, North Carolina. And for those of you that don't know where Waynesville is, it's 30 minutes west of Asheville. And Dr. Turpin, it looked like when I was looking at your bio that trauma is your specialty and that you've been studying the uses of psychedelics since the mid-1980s with a desire to bring psychedelic treatment to the mainstream. So thank you so much and welcome to the show.
Thank you for having me. Glad to be here.
So I think a great place to start for most people, I think most people have a basic understanding about psychedelic treatment. So I'd really like to start with just an understanding of who psychedelic treatment works best with and what that path might look like for somebody whenever they're coming into treatment for that diagnosis if they identify with that.
Okay. Pretty broad question in the sense that, psychedelics are not for everybody. And I think that's one of the common misperceptions that sort of led to it being banned in the early 70s, was Timothy Leary and, telling people they had the right to manage their own nervous system. And that if you took LSD, you would find your inner God. And then people would go take LSD, go to a party, have their childhood trauma coming up, and then end up in the ER and on the front page. So it's definitely not for everybody. I would say, generally speaking, when you think of the psychedelic compounds, people that have any kind of psychotic processing or thought disorder, diagnoses like schizophrenia, those folks are definitely probably not the best candidates for psychedelics. I mean, one of the things that happens in a macro, sometimes therapeutic dose of a psychedelic is the dissolution of the ego. So people that are already struggling with extremely fragile ego states, dissolving the ego is not always the greatest thing. I could see where it could potentially have some positive effects, but I would we're not prepared. We don't know enough about these compounds to be able to treat those kinds of illnesses yet. And I would foresee something like that being done eventually, maybe even on an inpatient basis if we decided to study that kind of thing. I think generally, a lot of psychedelics, there's several of them that have been around for thousands of years, and they've had lots of purposes, divination, healing, all kinds of things, and rites of passage. And so this idea of using psychedelics to treat mental illness is an old idea, but it's one that sort of came to our culture more or less in the 40s with the discovery of LSD. And then once Gordon Wasson did his famous trip down to Mexico and brought back knowledge and confirmation that psychedelic mushrooms actually existed, that one came into the consciousness of the West in the around the mid 60s, early 60s with Timothy Leary and the Harvard Psilocybin Project. But I think that, there's studies right now that you were looking at with psilocybin that are being done. Those are really starting to focus. Those have been focusing on issues such as end of life, depression and anxiety, people that they're terminally ill and are facing their impending death, and they're having lots of existential anxiety and depression. Psilocybin has been shown to be extraordinarily effective for that. Most studies are showing about 85% of people going through those issues with usually one or two psilocybin sessions will have a complete turnaround as far as being able to face their death. Another one is treatment-resistant depression has been shown. It's been very effective in some studies. Johns Hopkins has been doing some groundbreaking work with treatment-resistant depression and psilocybin. There's also good indications that psilocybin can treat obsessive-compulsive disorder. There were some early small studies done. Francisco Moreno at the University of Arizona did a small study in the early 2000s that had some pretty phenomenal results with very limited exposure to psilocybin. And so I think I see psilocybin as having pretty potentially wide utility on a variety, and we can talk later about why, like what's going on in the brain and why that kind of class of psychedelic is potentially well suited for possibly a wide range of treating conditions. I think psilocybin, kind of LSD, which was the main compound that was studied in the 50s and 60s and the early 70s before it all got shut down. It was really showing to be beneficial for treating trauma and mental health issues that sprung from trauma, which there's myriad mental health issues that spring from trauma originally, poorly integrated traumatic experiences. And so LSD was shown to be quite effective potentially with treating those folks. It also, there is a little bit of LSD research going on right now. There was just a study in Switzerland that finished that was looking again at end of life anxiety and depression. So psilocybin and LSD have been shown to be really good with those. MDMA, which is a compound that's been around since the early 1900s, was when it was discovered. And it behaves very differently in the brain than something like LSD and psilocybin. And the way that it behaves in the brain has shown that it can be extremely potentially effective for healing trauma. And there was a period there between the late 70s and the mid 80s when MDMA was legally being used very quietly with the therapists and psychiatrists. And not only was it noted that it was incredibly potentially great for treating trauma, but it was also really good for working with interpersonal communication issues, such as with marriage counseling, things like that, defenses went down and people could speak very openly and people could hear criticism and people could have some incredibly constructive sessions using MDMA that way. And then, there are some of the other psychedelics out there like ayahuasca, which has DMT as the psychoactive component. There's also ibogaine, which is it comes from a West African bush, the root of a bush. There's clinics that are popping up around the world, Mexico, Central America, South America, Canada for a while was using ibogaine legally. And those have been potentially shown to be very, very effective with addictions, PTSD, treatment-resistant depression. And addictions, as you all kind of know, most addiction is rooted in trauma. Sometimes it's a spiritual crisis as well. And so these psychedelics, even psilocybin, LSD, MDMA, they have all been helpful in various circumstances for helping heal some of that underlying stuff that's underneath things like addictions. So very wide range of uses. And, I think ketamine is also another one that's being widely used these days. It behaves very differently than any of those compounds I just mentioned. And we've been using that for a few years here. And we've seen it do some pretty major things with particularly treatment-resistant depression, particularly people that have been stuck and depressed for many years. Maybe they've been on SSRIs, they've been in therapy, and they're just stuck. We've had some success with treating those folks. We've had some success with people with PTSD, and it doesn't treat PTSD like an MDMA session will. It's not going to essentially go through and heal the traumatic memories and create movement and a more appropriate storage of trauma memories, which is what MDMA does. But what we're finding with ketamine is it allows people to kind of step outside their PTSD temporarily and find peace and relaxation, which we find can help them sort of readjust or adjust their relationship to their PTSD. They still have PTSD, but they seem to just be in a better place to handle it. And so we've got a lot of people, we've treated several people that are, really wanting to access MDMA, but they know that they can't yet because it's a Schedule 1. And so they're finding that ketamine can be, a nice way to be trying to work on some of these things, in the meantime.
Yeah. So something I'd like to talk about that you just mentioned. So you and I know what treatment resistant depression is, but I think sometimes part of what's so challenging with mental health is the stigma that exists because of the lack of understanding with when somebody has depression and when somebody has anxiety and they have PTSD. It's not like a person can just snap out of it. They just can't
Hmm.
snap out of it on their own. And so a lot of, I think, the stigma that I've seen is this shame that comes from the misunderstanding that I should be able to just snap out of this, which is a societal kind of expectation and belief, right?
Hmm.
Because we all go through different bouts of anxiety and depression. But but it's not to the extent it's not a clinical depression like what you're treating. And so one of the things I think is really important as you're talking about this treatment resistant diagnoses is the level of suffering, distress, the inability to function on a daily basis because of breakthrough symptoms that are occurring. And so I think that's really important for people to understand is that when you're saying treatment resistant, people have, when you say SSRIs, they've been on other forms of medications that they're seeing that this is the best they're going to do on these. Maybe there's been some slight improvement, maybe even they've reached a baseline with that medication, but they're not seeing continued improvement and there's still such debilitating symptoms that they don't have a quality of life that they want, correct?
Right. Yes, I would
Okay.
agree. Yeah, these are the people that have been, in a lot of cases, really doing the right things as far as our culture is concerned about dealing with their issues. I mean, they recognize they have a problem, they're tired of it, and they've accessed the more traditional routes that are open to them through insurance carriers or whatever, whether it's medications, therapy, in most cases, some combination of the two. So, yeah, these are folks that typically want to get well, and that they have been struggling with this, and that in many cases they're doing. We've had people come in, I mean, they exercise, they watch what they eat, they do yoga, they meditate, they're
Mm,
doing all the things that you would behaviorally try to get a patient to be doing to work with these things, and they're just not getting that level of relief or that breakthrough that they seek. And so, yeah, they start to feel shameful, like I'm broken, I'm not fixable, I'm permanently disabled or whatever. And yeah, that tends to undermine the confidence, and in many cases, and this happens a lot, is it undermines the desire to want to be around, if this is what
mm.
their life is going to be.
Yeah, and I would imagine that some confusion comes up too, because when you look at traditional, if there is a traditional depressive symptoms, like sometimes what you'll see is a marked inability to follow through in all areas of your life. So if you're talking about people who have the capacity to follow through with treatment, that they're actually able to work out and be doing all of the things that they're being asked to do, and they're still not seeing improvement, it feels like there could be some self judgment as to why it's not working when I'm doing everything that people are asking me to do. Right.
Right. Basically, I'm a failure is what it
Right.
feels like for whatever
Right.
reason. Yeah.
Right. And as you were talking about the ketamine, I was like, wow, I didn't know this about ketamine, and I know very little about ketamine. So it was exciting for me to hear that people, and it sounds like you said relatively quickly, experience episodes of peace and relaxation. And to me, if you're pushing through with that level of depression or PTSD or anxiety, and you have a moment of experiencing that peace and relaxation, there has to be a tremendous amount of hope that comes to people relatively quickly, that I can actually feel something because this is inside me. I can actually feel something like this. It's working. Like, to see that so quickly has to be like a real encouragement for people.
Yeah, yeah, I think so. And ketamine is a very fast-acting compound. We tend to favor intramuscular injections, and so when you get your injection, it's going to hit you in 3 minutes. Typically, is what we
Mm,
see. And yeah, that's exactly what I tell people. It's like, I tell people when they're coming in, do not expect the ketamine to do all the work. You will likely be disappointed because you might feel great when you come
mhm,
out of a few sessions. But if you don't pay attention to what that your information you're getting from the ketamine state, which is really from the deep self, and if you're not integrating these insights into your real life, making changes in your life, what we see a lot of times is people will revert back to baseline within 4 to 8 weeks, without any more ketamine. And so we really emphasize when people come in that you have to be ready to do this work, that the ketamine is going to afford you a glimpse into your deeper self. It's going to allow you to have some contact with what we call this innate inner healing intelligence that we all have.
mm,
And it's going to give you information, whether it's through sensations and impressions or imagery or insights. And part of what we do is we try to capture all those images and insights. And then in the integration phase, we work with people about, what do you think this means? What do you think it's letting you know? And I find I have to say, I can't say 100%, but I'm kind of operating on the theory that almost everything that emerges in a ketamine session, no matter how bizarre and out of this world and absolutely crazy it can be, is chock full of information about, this is who we are, this is what we need, this is what our deeper self is longing for. And it's hard to get to those spaces and talk therapy, frankly. It takes years and years. And even then, sometimes, it's a top-down method. And I feel like psychedelics are a bottom-up method. And so that's why I think the combination of the two is dynamite therapy along with psychedelics, because you are bringing to bear all of this and having a potentially unique approach in how to get at some of this deep stuff. And our patients can trust it, because it's not me telling them, hey, try this or do this. It's something that's coming from their deepest self, and they can trust it because it's them, it's their deeper self. And we let them know, people come in with this very limited aspect of who they are. They've been depressed for years. They're a failure. They're not socially adept. They don't know how to enjoy themselves. They don't know how to connect to people. They have this very, smaller idea of who they are. And a lot of that's the default mode network stuff that we can talk about. But ketamine and a lot of psychedelics, ketamine, though, when we teach people, it's going to open you up, and you're going to see aspects of yourself that are way beyond the depression or way beyond the PTSD. And they're just as real as the depression and the PTSD stuff. So people really like that idea that they can get in touch with some of the beauty, and some of the hope that they have. And like you said, to be able to step outside their condition, even for an hour, and to feel this peace and to feel separate from it, it gives them a context to understand what they can feel like. It gives them, and even though they know that the compound's in there stimulating these experiences, we let them know everything that's coming up is just you. It's all a part of you. And so when you're having these incredible, beautiful visions, or when things are happening, this is all part of who you are. And it's really, I found that to be, sometimes when we're doing integration at the end of a ketamine session, and somebody will be describing some really profound image that they saw, or incredibly beautiful image, we'll just say, that's you. And they just kind of like, I've had people burst into tears when you tell them that, it's just, they kind of forgot all that was there.
Yeah. Yeah. I can imagine that there's so much, like I said, self-judgment. And then to have just that, your reinforcing of that is so critical, because on their own, somebody who's without any kind of treatment professionals around don't necessarily have access to that lens and capacity to have that link to that understanding, right? You're putting
Right.
your own beliefs and understanding, and some of that could be, you called it a default mode. I think it's the same language I use for like operating system. Like we have this earlier operating system that's kind of, a filter that everything goes through. And, so it's still, the inner dialogue is still going through that operating system until you have this opening and this receptivity and professionals guiding that new understanding, right?
Right. And the default mode network was discovered not all that long ago. I think it was the late 90s. Somebody came up to identified it. But yeah, it's these brain structures and these neural pathways that have sort of formed over time and been reinforced over time. These are experiences we've had. Maybe we've had social failures, maybe we've had whatever kind of failures, academic failures, relational failures. And, so it starts to, they kind of feel like in some ways that's the seat of the ego. That's kind of where the ego comes from, is all of these neural networks kind of wiring together over time. And, we find that people spend the most amount of time in that default mode network when they're not outwardly goal directed doing anything, and they're sort of ruminating and thinking about themselves. They're comparing themselves to others. They're evaluating themselves, what kind of a human being they are, how successful they are, how am I doing? What do people think of me? And we find that depressed people spend an inordinate amount of time in that default mode network, ruminating and just thinking. And so one of the fascinating things that happens with most psychedelics is that like with psilocybin and LSD particular, and ketamine too, to a certain extent, they've shown through functional MRIs that default mode network quiets and goes down. And when the default mode network goes down, it allows all these other areas of the brain to connect and to communicate.
Mm.
And they feel like that might be psychologically one of the big antidepressant effects of ketamine. And I mean, there's biochemical things happening, but psychologically, emotionally, it's that ability to shut down that default mode network and to be able to see, to have other parts of the brain come online that might have a real healing factor in things like depression.
As you said that, it kind of gave me a visual. It reminded me of people that are practicing meditation
Mm-hmm.
over long periods of time. Um,
Yes.
Sometimes I think people think, "Oh, I've tried to meditate, and I'm not really good at it." And I'm like, "Well, none of us really are in the beginning. Like, it takes a long time to kind of have that click to where I think what you're describing, where parts of the brain, this default mode, can actually
Mm-hmm.
relax and allow for other parts of the brain to come online. And it sounds similar.
Right, exactly. And I think that's kind of a little bit of what we're seeing as to why maybe some of our PTSD patients are getting so much benefit from the ketamine is it does allow you just become identified. That PTSD becomes your identity. That's how you function in the world. You're always having to compensate. And when that goes down, I think that that also allows people to sort of step outside and to get that bit of relief and that different perspective and to
Yeah.
be able to, we have one lady that comes in, we allow her to come in monthly. She's a veteran. It's pretty severe PTSD, and she just says it's just to get to this deeply relaxed place.
Mm.
That's what she's going for, and it's been very helpful.
Yeah. So what does it look like when somebody's coming in and you've determined, and I'm sure it's a pretty robust uh, assessment as to, given what somebody's current diagnosis is and what their treatment goals are. I'm sure it's robust to determine which of the treatments that they're going to be involved in and what your recommendations would be. But once somebody's involved, I read online that you have like guides that go through this. So what does this look like for somebody who's going through treatment? Because I've heard you talk about this integration, and I'm presuming that there is within the session as well as after the session some work that's going on.
hmm And I can really only speak to, I can speak to ketamine for sure,
Okay.
because that's the one thing legally we're allowed to be able to provide for people right now. It's a
Okay.
Schedule 3 medication. So, if you have a physician with the appropriate licensure, we can do ketamine. MDMA is still Schedule 1, and we were allowed this little window to treat a few people through the FDA's expanded access program with MAPS, the Multidisciplinary Association of Psychedelic Studies. They're our sponsor. And I would recommend anybody that wants to learn more about psychedelics to visit maps.org. They have a really nice webpage that shows you kind of what all's going on. They don't do much with psilocybin, but they're very much at the forefront of MDMA, cannabis
Okay.
research, things like that. Um, so, MDMA, like I said, that's a very limited thing that we're about to finish up, and then we're going to have to stop in January and just wait with everybody else for the FDA to hopefully approve it. Maybe, what I'm hearing is maybe this time next year it's going to take for them to approve it. So really ketamine is the one that I can speak to, because that's the one that's probably the most practical since we're able to use it. But I think when people come in, we do their assessment, and what we're typically looking for, it's just a really thorough psychosocial. We want to understand, what are the number one, what are the problems that you want to try to address, and then we want to get a really good psychosocial history so we can understand the trajectory of these issues. How did these issues form in the context of your life? How have they influenced your life? Things like that, because I think it's important, particularly when we're trying to help patients understand the content of their ketamine sessions, that we have a good idea of what's the background this stuff is all coming out of, so that we can, not necessarily tell a patient this is what it means, but, we can sometimes nudge and say, what do you think about this? And then we just wait to see if they're like, oh yeah, I think that's what it is. Or people will say, I don't think that's it. And so we really try to help the person come up with what their own meanings are. But we do typically, we'll do a psychosocial assessment so that we can get good and informed about what's likely to come up and what we're working with here. Then we usually put them through a medical screening with one of our prescribers, just to make sure there's no contraindications medically, make sure they're safe for using ketamine, which I will say ketamine is a very safe compound. And then we usually have preparation sessions. A lot of people that come to us are really only need one prep session. That's about 60 minutes. And really what we do is we just get them ready for the effects of the ketamine and how to work with it. We teach them about breathing. We teach them about surrendering, not trying to control things, not trying to avoid things, be open to whatever comes up. We find that most people have very positive to neutral types of experience. A lot of people come in scared, because they think, oh, I'm going to see like the worst things in my life, the things that I fear the most. And, while that's possible that these things can maybe show up, I try to remind people everything that you're going to experience is nothing more than a manifestation of some aspect of yourself. So there's really nothing to fear. It's there to teach you. It's there to offer information about things. And so be curious about it, move towards it. And so after preparation, then we get ready. And some people, I've had people come in maybe that have severe PTSD. We may do 3 or 4 hour-long prep sessions. It really just depends on kind of how we feel they're suited and ready for this. But I would say probably most people are okay after after intake, med screen, and 1 prep session. They're usually ready to get going. But then we're starting to do the work. And our ketamine sessions are 3 hours long. We have the therapist in there with the patient the entire time. The prescriber is in there as well. And, those are typically where, we're taking vitals, that kind of thing. And then when we give them, let's say, an intramuscular injection, I am a big fan of what we call split dose. What we find is that there are a lot of, I'd say most ketamine providers will give the ketamine all in 1 dose. And what we find is that there is a very rapid, taken off. And then there's kind of this come down period. And that I find that when we get up into the higher doses, it's harder to recall things. And so what we discovered almost kind of accidentally, experimentally, was that if we break up the dosage, let's say somebody's getting an 80 milligram dose, we might give them 50, and then 15 to 20 minutes later, we'll come back and give them a 30. And so the takeoff is a little more gradual, and it also getting that booster 15 to 20 minutes in allows the session to kind of last a little longer. And we just find that people's recall is much better. And so there's more that they're bringing back to work with. So I'm a big fan of, at the Pearl, unless there are certain situations where doing it all at once is probably the wisest thing to do. But I'd say probably 80-90% of our cases are these split dose. And so we give them the ketamine. The ketamine experiences last anywhere between 45 and 70 minutes. We had one lady that routinely went 90, but typically they're around an hour. And then when they come out of it, we have a very definite way of doing it. The lights are low. They've got their headphones and their eye shades on for the extent of the ketamine experience. And then once they come out of the eye shades and the headphones, we kind of unplug and have just the background music. And I just tell people, take your time, breathe, just relax, take your time coming back into the room. And when you're ready, just start talking to them about what you remember. We're not going to analyze anything right now. We just want to try to, what do you remember from it? So we kind of write everything down. We also invite people during the session to speak if they can. If they can say, here's something I want to remember or whatever. We've had people that can narrate every second of their experience. And then we have people that just can't say a word.
Right.
One guy came out and said, did you get everything? And we were like, you didn't say anything.
You didn't say anything. Yeah.
Yeah. But so the integration period starts as soon as they come out of the ketamine, and it starts with recalling what came up. And then we spend the rest of, this is why we do 3-hour sessions, because typically by the time we do, pre-game and then do the ketamine and they come out, I love that we have an hour and a half. I call it the golden hour, because when they come out, their defenses are down, they're open. They hopefully have just had this kind of expansive experience. And it's just an amazing time to start connecting the dots. What do you think that means? That's kind of what we say when we talk about, I saw this thing. Well, what do you think that means? And they might say, I don't know. Or they might say, they might have a definite idea. Oh, I know what that is. It's this. And then I think this is where it's important, I think, to have a clinical background and some experience is when you understand people coming in with certain clinical issues. And I'm not talking about the worried well necessarily coming in for growth work. I'm talking about people that are coming in with clinical issues, treatment-resistant issues. I think it's very important to have that clinical background and experience, because you understand how these things formulate psychically over time. And so when you are helping a patient interpret what might have come out in the ketamine session, it's not that you're they're forcing a theoretical framework on them, but you have some indication that if some image or something comes up, it could possibly be tied to this thing that we know clinically is responsible for the formation and possibly the sustaining of this negative, self-image or whatever it is that's feeding the mental illness. And so I do think it is important to have at least one person in the room that's got that clinical training and that experience. But we really spend that last hour, hour and a half really trying to make the most of connecting the dots and what it might mean for them, for their issues going forward. And then at the very end, what we do that I think is very important, this is a Phil Wolfson concept of this idea of anchor points, because, these things, I tell them, it's like waking dreaming. And just like a dream, if you don't sit with it and work with it, it's going to fade over time.
Right.
And so before we leave, I tell them, now you're about to walk out, you're about to go back out into the world. Tell me what anchor points, what images or thoughts or things that came up really are salient to you and what you really feel like are speaking to you. So I really make them name, these are the things that I want to make sure I don't forget. These are the things I want to carry out. And so then I usually check on them that night with a text, hey, how you doing? And then we schedule an integration session, usually somewhere between 1 and 4 days after, 2 to 5 days after. We'll get online for an hour and I go back through my notes from what came up during the session and what we talked about in that first integration session. Because there's people that'll forget about details of things. They'll be like, oh yeah, I forgot about that. And so it's all about helping them bring all this previously unconscious material into their everyday life. And that is the essence of the integration process, is you get all this information and then what do you do with it? And life is integration. I mean, just going out living your life presents opportunities to integrate, to start to practice these things, to look at things in a different way. And so we're there trying to help people do that, because to me, that is the most critical thing as far as whether the benefits you're going to get from psychedelics are going to last or not, is how much time and effort you put into the integration process. And so, yeah, to make a long story short, that's kind of what we do. And after an integration, sometimes 2 integrations, we might get ready for another one. We tend to try to do, if somebody's coming in stuck with a clinical issue, we typically look at doing once a week sessions, because that gives time for integration in between sessions. We have had people that have come in super stuck, and we might do 2 fairly quickly within that first week to kind of like blast them out of that stuck place. But typically once a week is, we found to be the most effective. And I've seen that most people generally get the most benefit from, we've had people do 2 sessions and be like, man, I'm great, I got everything I need. And then we've had people that need usually somewhere between 4, 5, 6, maybe something like that. And then maybe they go out and they come back every couple of 3 months for a booster too. But we've had a lot of people come and do their series of sessions, and then we don't see them again. So one of the things I want to do is send out some, I'm interested in putting a questionnaire out to our previous patients and just asking them, hey, how are you doing? How long did this last? Are you, just trying to get some idea about how long this way that we work with ketamine, how successful is it? The fact that we're not hearing from you, is it because things are great or what? So that's something I think that I'm interested in.
Yeah, that's from a research perspective, I would imagine that would be really important to understand, over time. And then also, what other types of treatments are they continuing to be involved in? Are they utilizing that in therapy? Or, as you said, like talk therapy can take years, right? Or were they able to see well enough, success in a period of time to where they've discontinued, and like you said, they're functioning and doing well.
Yeah. And I think this stands for, we see this in the MDMA work as well. I think the people that have really put some effort into therapy going into these treatments, like they've already been wrestling with this stuff, they've already been exploring and trying to understand themselves. Those are the people that seem primed to get the most out of this work.
That's that's perfect. I was going to ask about like kind of what are the best conditions for success, and that's what you're describing as somebody who's got this genuine curiosity and willingness to explore and probe what comes up, because as you said, it's the golden hour. It's where all of that information comes up that's so rich with resources and capacity to help somebody break through whatever kind of blocks or traumas that they're dealing with.
Yeah.
So I'm kind of curious, how did you get into this? Like you've been doing this since the mid 80s. Like what was it that you saw at that time? Because in the mid 80s, I mean, it like, I mean, now it's even kind of like still on the fringe. So what were you seeing back then that said, I want to work in this?
Well, my first experience was 1984, and we were knee deep in the Nancy Reagan "Just Say No" thing. Where they were the commercials on TV of "This is your brain on drugs," and they'd show an
Yep.
egg frying, things like
Yep.
that. So the climate in the country was not exactly conducive for this kind of thing. But
Right.
I stumbled upon, I don't even remember how I got a hold of it, but I stumbled upon Timothy Leary's autobiography, Flashbacks. This would have been 84, I think, and read it. And I was just intrigued by what he was writing. And so me and a couple of buddies located some psilocybin mushrooms, which wasn't hard to do in Athens, Georgia, in a college
Hmm.
town. So we had my first experience, and very briefly, I was an advertising major at the time. I was ready to go use my creativity to go out and make tons of money. That's what I thought I wanted to do, and it just slapped me across the face and was like, "What are you doing? This isn't going to make." And I had this realization that existentially, I was going to be very unsatisfied with that path, and so I became fascinated with what was going on in my own psyche. And I knew that that knowledge wasn't in the mushrooms that I took, that it was unlocking some aspect of myself that had been probably socialized out through high school and all of that. So I became fascinated. And I just had this insight about, how much it could help people to be able to access these parts of themselves. And so I thought, I want to learn more about this. And so I went to the UGA library for years and just made copies of every article I could find. Most of it was on LSD because that's what most of the research was. But I went to the library and just was fascinated by how much research had been done in the 50s and 60s. And
Hmm.
then it had all been shut down and nobody knew
Yes.
anything about it. I mean, I'd go to my professors at UGA. I remember the department head, he was like, don't waste your time with this. There is no future in this. There's no career in this. Don't waste your time. It's been tried and it didn't work. So I think going out and reading all the research and just realizing that there were things going on, and granted, the research from back then was poorly designed. Psychedelics have always been challenging to do the traditional double blind because it's like usually within an hour, who got the psychedelic and who got the placebo. So it challenges our time honored ways of doing research, and so they were trying to apply psychedelics to these old kinds of scientific things, and it wasn't always given, because the psyche, the contents of the psyche are probably the thing that influences the experience even more than the compound that you're taking. And so that sort of double blind thing does not take into account the individual differences and the contents of the psyche that are coming into play. So they had these results that would be all over the place and not, they wouldn't be consistent. And so they just dismissed these compounds more or less because they wouldn't behave according to the model we were trying to force them into. So anyway, I changed my major to psychology and just made the kind of just vow to myself that I was just going to take I was just going to quietly keep researching these things, and that maybe one day I'd be able to do something like this legally. And then it informed kind of where I went to school. Once I graduated from the University of Georgia, I went to West Georgia College, which at the time was kind of a little bit of a fringe humanistic master's program. And then I ended up at the California Institute of Integral Studies out in San Francisco, which today is kind of a leader in the whole psychedelic training movement. But all this still was very fringe when I got there in 1991. So that's kind of how I got into it. And it's just been a big part of my own growth and development. And it's just been really, I'd kind of given up hope thinking, well, I'm either going to do underground or I'm going to die without being able to do this stuff. And I never did the underground thing just because I had too much to risk with it. I had kids and everything, and I just wasn't going to. Plus, I wanted to be able to legitimately do it one day. So I resisted the underground thing, and then lo and behold, MDMA started making this appearance, and studies were showing some things that were really positive, and there was some momentum building behind it. And there was a lot of wisdom, I think, in Rick Doblin picking MDMA to be the one that became the first psychedelic to try to cross the finish line of approval for many reasons. So that's kind of how I got here. So the Pearl Psychedelic Institute, which is the nonprofit we're working with right now that we started, it's kind of a culmination of all of these years of wanting to have something that was a vehicle for doing this work. And so that's kind of how I got here.
Yeah, interesting. Thank you. So, when you were talking, I was thinking about, so I'm a licensed mental health counselor, and now I'm an authenticity and intuition guiding coach. And one of the things that I'm really passionate about is helping people discover what their own inner desire is, whatever society has told them, whatever their well-intended family and friends has told them that
Hmm.
they can do in their life. I'm really encouraging people to listen to the whispers, listen to
Hmm.
those things. And so it sounds like you had an experience back then where you took a substance that actually got to that part of you.
Yes.
But what I'm working with people on is getting to that part of them that says, what do you really want to do? And
Hmm.
what's really going to be satisfying? What's going
Hmm.
to be uniquely satisfying to you? So as you were talking, I saw you on this panel discussion where they were talking about the shadow self, right?
Right.
And so for me, I would be interested in understanding how you describe the shadow self. But for me, I look at the shadow self as like it's the traumatized part of us, or the part of us that has been um or like written over. It's that operating system that's there that isn't aligned with who we uniquely what would uniquely make us like a satisfied and happy human being. It's
Right.
that part of us that kind of didn't even know that we were passing on this, whatever this is inside. We didn't even have access to that, right? We
Hmm.
just barreled over that. So, but I would be interested on uh, what do you on this panel? You talked about shadow self. How do you define your shadow self, and how does that come into your work?
Yeah, well, I think the shadow is, I mean, I kind of revert to the Jungian interpretation of it. And I think it's the parts of ourselves, whether it's experiences that we've had or whatever, things, parts of ourselves, pieces of ourselves, parts of who we are that really don't jive with who we want the world to see us as, basically the ego. We have this ego. From the ego comes the persona, which is sort of the face we want to put out to the world. And so all these shadow aspects are the parts of ourselves that we don't want to own, they're not congruent with the ego and the persona. So these things get kind of shoved aside in the service of the ego.
Mhm.
And so I do think that it's just these parts of ourselves that we're ashamed of, things that are not congruent with the image that we want to portray to the world, or the way that we want to feel about ourselves. Like, we have to be able to go out in the world and pull off life. And we can't be completely thinking about all the terrible things about ourselves if we're going to go out and function.
Right.
And so I think that it's really a protective mechanism that sort of pushes these things to the side into the unconscious so that we can go out and be able to function and feel okay about ourselves. That's
Mhm.
essentially what the shadow is. And I think psychedelics, because the ego, I think, is the one thing that really resists the shadow coming into consciousness. I think one of the things that makes psychedelics so effective in doing this kind of work is that, you've heard of ego dissolution, things like that can come with psychedelics. Just the same as when you're asleep, and the ego sort of goes off to the side and all these things are allowed to come up in your mind while you're sleeping so that you're processing things. I think psychedelics do essentially the same thing, where they sort of, we can say they dissolve the ego, or they push it aside, or the ego goes to sleep. Sometimes we'll say that in ketamine work. But the ego sort of goes offline for a little while, and then that allows these aspects to come up. And ketamine has been a different one, has been different. MDMA has been a little different. I mean, definitely we see aspects of shadow work coming up, absolutely, in both of them. But I would say, probably just from my own experience, like LSD and psilocybin really take you into the shadow. I think those are really well-designed compounds that are really well suited for shadow work.
Okay. And you've been describing utilizing psychedelics with psychiatric diagnoses, but you
Hmm.
mentioned earlier that there is it sounded like that if somebody had maybe a spiritual wound or a desire to have more of a spiritual connection, that
Hmm.
there would be some promise for psychedelics for that experience. Is that something that somebody could go to the Pearl Psychedelic Institute to experience, or is it mainly working with psychiatric issues?
I think we have both. I think our vast majority of our patients are people that are struggling with fairly significant clinical psychiatric issues. But we'll have certain people that are, functioning pretty well. They might, I mean, we all struggle. I mean, good Lord, even if the most
Yeah.
functional of us are still struggling at some level. I guess there's some actualized person out there. I haven't met them yet, but so I think, but there are folks that come in that are really just feeling like we had one lady who was just, I think she was in her 60s or 70s and was just feeling blah and was
Mm,
just feeling like, great, this is my life, you know, and as a result had kind of become afraid and not doing some certain things, had been kind of less willing to take risks. And so she
mhm.
had kind of gotten in this, oh well place. And ketamine work was very helpful and sort of just, letting her see the bigger picture again and to realize you have some say so over these things, and so we do have both.
So I saw this quote that I thought was excellent and interesting, and I'd like to just hear your thoughts on, when people have a limited number of quotes on their site, you know that they went through a lot, and they had to actually narrow it down to choose this one. So you have Albert
Sure.
Hoffman says, "Evolution of mankind is parallel by the increase and expansion of consciousness."
Hmm.
Can you talk a little
Yeah.
bit about why you chose that quote and why that's meaningful given your work?
Well, Albert Hoffman, as you know, was the discoverer of LSD. He essentially was the first human being to take an LSD trip, accidentally at first, and then on purpose. And he was also the chemist that was the first one to identify the psychoactive component of the magic mushrooms, which was psilocybin. So um, he died at like 102 a
Mm,
few years ago, and was sharp as a tack up until the end. And so he's obviously had a lot of experience with psychedelics. Again, he was like the creator of one of them, and he took a profound interest in LSD and psychedelics throughout his life. And I think this quote is about the fact that, and then this plays into the shadow stuff, because the idea is that, it's not about eradicating the shadow. It's not about killing off the shadow. It's about making the shadow conscious. IFS and
mm,
all this thing about parts work is a similar thing. It's about finding these parts of ourselves that have been relegated to the unconscious, yet they're down there strongly influencing the way we view the world and the way we behave. And I think the more we work to repress these things, the more they're going to potentially come out and create problems. And so I think that, this idea of consciousness expansion, it's just about becoming aware of more. It's becoming more aware of what all is out there.
mhm,
Ultimately, that we're all human beings. We all want the same things. There's nothing to be
mhm,
afraid of, regardless of skin color or sexual, or gender or
mhm.
any of that. We're all just people and we all want the same things.
Right.
Um, and also the reconnecting with nature. I think that's something that
Mhm.
psychedelics can very often afford, that we are at our own peril, have just sort of ignored this. That's why the planet's on fire. And then when you think about internally the whole idea of consciousness expansion, it is that idea of learning to, getting those deeper aspects of the self up into consciousness so that we can integrate them and become more whole. And again, it's not that these shadow pieces are going to be done away with, but they're going to be acknowledged, they're going to be accepted, and by doing so, then they lose a lot of their power, and you're able to just make choices about how you want to behave morally or however you want to be in the world, instead of these repressed, suppressed impulses and aspects of yourself that, they're there working underneath the surface, whether you believe it or not. And again, the more you repress these things, the more likely they are to come out and do something, potentially more damaging. So I think the reason we chose that quote is that we just believe that that is absolutely true, that we need to become more aware of this world that we live in. We need to be aware of the environment, our fellow human beings, not just Americans, not just Russians, but the
Mhm.
fact that we're all human beings on this blue ball, and we
Yeah.
need to reconnect with nature, and that we also need to become more comfortable with who we are. We need to get to know ourselves. And so that's what I thought that quote meant and why we included it, because it just kind of says it all in a
Yeah, it
very
really
concise
does.
way.
Yeah, it really does. It's beautiful. And I think that there is to me, when I look at it, I think about our collective evolution, right? That
Yes.
that it's all of us being able to experience this increase in expansion in consciousness, which is what your work is doing, is it's giving an avenue for expansion for people that have maybe struggled through traditional means of what we've known so far to be able to experience that.
Right. And psychedelics are only one way. That's
Right.
just one way out of
Absolutely.
many to do that. And Jung was kind of, he died in the 60s, I think 61 or 66, I can't remember. But he was aware of psychedelics. He was friends with Carl Behringer, who did some
Mm,
mescaline work. But there's always this thing like, did Jung do psychedelics? How did he get all this deep knowledge? But the conventional wisdom is that he never did psychedelics, but he
yeah.
did caution against using things like psychedelics because he felt like he had a good quote about, that something about, unearned wisdom is not necessarily a good thing.
Mm,
This idea of being able to circumvent the defenses of the psyche and go right into all this stuff can be very dangerous.
mhm,
He felt like that was what happened with the rise of the Nazis. He saw the
mm,
swastika, which was actually like the reverse of a Hindu spiritual symbol, and he knew right away this was going to be super dangerous,
yeah.
super dark, and super activating of people.
Mhm,
And so I think that being able to bring these things into consciousness and to accept them is really what we need to be doing, and that's the work that we need to be doing as a species as well.
mhm.
It's we're I think we're in for some issues and some problems, and we just seem to continue on this reckless path to just doing the same things we've always been doing. And again, psychedelics are one way to access this stuff, but I do believe that without going in prepared, without
Mhm,
paying attention to crucial factors of set and setting, which is something I would give Timothy Leary some credit for.
mhm.
Um, but the integration process, I mean, look at all the people in the 60s that took acid and everything. And, some people changed, but other people, bad things happened, or
Right.
they went on to do things that were destructive. And so
Mhm.
taking a psychedelic doesn't necessarily enlighten you,
Right.
but it does provide material that if you can integrate it properly and you've got set and setting, things like that, it can provide these expanding experiences.
Yeah, great. So as we look to wrap up, I would like to ask if there's something new and promising that you're seeing in the research that you're doing. Uh,
Well, I am very encouraged by what we're seeing with the ability of MDMA to heal trauma and post-traumatic stress disorder. Recently, some of our more recent patients, these are people in their 60s and 70s that have in some cases had PTSD for 60 years. And the ability of this compound to go in and heal the damage that these people have been dealing with and compensating for decades has been really phenomenal. But one of the things we're noticing too is that when somebody's had PTSD that long, it's an integral part of who they are. It's how they're in the world. It's how they've been in the world for decades. They've had to
right.
compensate and plan and behave accordingly to this PTSD. And then when it's gone, or so reduced that it's no longer a factor, it's kind of a scary thing. It's like, I
Right.
mean, it's a great thing because it's like, yay, I'm sleeping now. I'm not having nightmares. Like, I feel like I want to be around people, but it's scary as shit too. It's just like,
Yeah.
how do I do this? I've never
Right.
been this person. And so one of the things that I think this research has opened me up to is that these things are phenomenally powerful, particularly for trauma healing, MDMA, but that we really need to pay attention to what we're going to do with these folks once they've gone through this treatment, how we're going to
Mm,
help them integrate back
mhm,
into the world and to be these changed, healed people. But
mhm.
I think MDMA, if I think the research was very well designed. I think the results were extremely robust, and I think also in a little bit of long-term follow-up that's been done, these results seem to hold up over time. And so
Mm,
I think MDMA is a potential game changer because I do believe that trauma underlies probably 90% of the mental health issues I've ever treated in my 30 something years of
yeah.
clinical work.
Yeah.
And if we could ever go in and heal the trauma, then all of our top down psychotherapy techniques are going to be much more effective. So it's not like we're all
Right.
going to be out of a job because of
No.
psychedelics. It's going to actually, I think we're on the verge of a 100-year leap potentially in our
Yeah.
field, which is we're way overdue for. I think you'd agree.
Absolutely.
So MDMA, I'm hopefully will be I'm hoping will be approved by the FDA maybe in a year. That's what we're kind of looking at, maybe, hopefully.
Yeah.
Psilocybin is another one that's moving into their phase 3 studies, which is the last phase before the FDA can look at approval. And so we might be somewhere between like 2 to 4 years down the road for that. And then ketamine is around. And I think I was not that big a fan when I first started, just because everything I'd been reading, that 30% of people don't respond. Some people can have phenomenal gains, but then they revert back to baseline within, 6 to 8 weeks, something like that. But I think, again, once we've gotten better at learning how to prepare people, how to structure the sessions, how to make the most of getting that information and integrating it, I've seen some really great things happen that seem to be holding up over time as well. So I'm definitely much more of a fan of that. I think a lot of it just has to do with how you work with it. And there's a lot of these pump and dump clinics that are just like, you pull in, they'll just hook you up to an IV and the nurse leaves the room and they tell you, we're not going to have a psychedelic experience. Listen to a podcast or something. And it's just a purely medical model. And those are the people that might get phenomenal results. But then typically, if they don't keep taking ketamine, they're going to go back to baseline. So I think we're learning more and more about how to use that one. So those are the three that seem to be on the forefront of potential use. And then we've got things like ayahuasca, ibogaine, which if we had more time, we could talk about those types of things. But I think those are also very potentially powerful tools to be doing this work. But they're a little more behind these three that I just mentioned that we've been more focused on, at least in kind of Western culture and science culture.
Yeah. Thank you so much for what you're doing to research and advance this particular type of treatment. I know that there are so many people out there who need this additional option. So appreciate what you're doing in the field. And if somebody wanted to learn more about the Pearl Psychedelic Institute or yourself, how would they get into contact with you or read more about you?
We have a website that's pearlpsychedelicinstitute.org. And that's a great place to start. There's blogs that talks about our training programs, things like that we're doing, give some history of the Pearl, all that. So I think that'd probably be the first place I start. And then we're also on social media, Instagram, Facebook. I don't understand all that. I'm old. I don't do social media. So that's not my department, but people can go on Facebook, Instagram, Twitter, and be able to kind of keep up more on a day-to-day basis of stuff that we're posting. And we're putting things out there that we're doing around in the community. So I would say our website, pearlpsychedelicinstitute.org, and then check us out on social media. And that would be a great way to sort of see what we're up to and to keep up with us.
Great. Okay. Well, thank you so much for your time. I appreciate, I learned a lot in our time together. So I appreciate you and your time.
Yeah. Thank you, Beth. I appreciate it. I enjoyed it.
Okay. So thanks to Micah McKenzie for the incredible cover art for Click Moments. Appreciate you, Micah. And until next time, my friends, peace, love, and light.
Do with these words what you will. It's time for us to be for real. You'll be stuck on the ground until you finally break the shell.